I'm doing the anterior drawer test to test the ACL. So I'm gonna have the patient lying supine, and then I will bring their knee into a little bit of flexion. I will sit on the end of their foot. I'm going to grab the tibia and then try to anteriorly translate it. Looking for an endpoint. And then I will also do the Slocum test, externally rotating the foot. Sitting on it once more. Test this test for anterior medial instability. And then I will also internally rotate the foot, testing for anterior lateral instability. Alright, I'm going to be doing the valgus stress test for the MCL. So basically all I'm going to do is I'm going to place my left hand above the medial malleolus, and then I'm kind of going to place my right hand on the joint line of the knee. I'm going to stabilize the left hand in between and his left foot in between my torso and my arm. And then I'm going to produce a valgus force at 0 degrees. Then I'm going to bring him up into about 25 degrees of flexion and produce a valgus force once more, checking for an endpoint. All right, I'm doing the Lachman's test. This is testing for the ACL. So basically what I'm gonna do is place my right hand right above his patella, trying to grab the femur, and then place my left hand on the tibial flare with my thumb on the tibial tuberosity. I'm going to try to anteriorly translate the tibia and then force the femur down. And I'm trying to look for an endpoint. I'm doing the pivot shift test. It's testing for the ACL and then also testing for anterior lateral capsule instability. There's 4 stages to this. So I'm gonna grab the knee. I'm going to internally rotate the femur. I'm going to axial load and then put a valgus stress on and then flex up. What I'm looking for in this test is for the tibial plateau to sublux. And then if it is a positive, we will do the Houston's test, which is bring the knee back into its normal position, and the tibial plateau should go back. I'm testing for the LCL, so I'm going to place my hand above the lateral malleolus, then my left hand at the joint line of the knee. I'm going to stabilize between his left leg in between my torso and arm, and then provide a varus force to the knee. And then I'm just looking for an endpoint. I'm doing the Godfrey test. It's testing for the PCL. I'm gonna have the patient laying supine. I'm going to pick up your legs and flex them at 90 degrees, looking for the tibial tuberosity to sag posteriorly. Then I will be doing the Loomer's test, which is testing for excessive external rotation of the tibia, which is going to be at 90 degrees once more. Then I'm going to externally rotate the feet, looking for any excessive tibial rotation, which could also mean the PCL story. It's the Bowdable patella test. What I'm going to do is make sure he's in a relaxed position. I'm going to find the patella and push it posterior into the trochlear groove. And I'm looking for his patella to return back to its normal position. It's the sweep test. It's testing for intra and extracapular swelling. So basically what I'm going to do is I'm going to take my left hand and apply pressure and sweep up towards the patella. I'm looking for displacement of fluid towards the lateral side, and this could mean that there could be PCL, ACL, or chondromalacia going on in the knee. I'm going to be doing Q angle. So first I'm going to find my patient's ASIS up on his hip, which is about right here. Then I'm going to take the straight arm and put it down the tibia, along with putting the axis in between the infrapatellar and tibial tuberosity. And then I'm going to line up the movable arm with his ASIS and femur and follow it up. And she has about 7 degrees for his Q angle. I'm doing the Wilson's test. I'm gonna have my patient just sitting up with his knees extended off the table. I'm gonna ask him to rotate his foot inwards and then extend or straighten his knee. If he gets to, let's say, here and there was pain, I would then ask him to rotate his foot outwards towards the wall. A positive sign would the pain would go away. This is the Noble's test. It's testing for I-band flipping over the lateral femoral epicondyle. I'm going to have the patient sitting up with his legs off the table. I'm going to find his lateral femoral epicondyle, and then I'm going to ask the patient to straighten his leg, and then go back down and continue doing that. What I'm feeling for is the I-band to be flipping over the lateral femoral epicondyle, and that would be a positive. I will be doing the Ober's test. This will be testing for I-band tightness. So what I'm going to have the patient do is lay on your side, have this knee bent at 90 degrees. I'm going to take their leg and clamp it between my arm and my torso. My left hand is going on the pelvis, and then what I'm going to do is rotate the knee down towards the table. Positive for I-band tightness would be the knee does not touch the table. He's negative. I'm going to be measuring circumferences of the knee and then up the thigh. This is normally used when patients have atrophy to see how much muscle was lost, or this can be used to find intra or extracapsular swelling. So basically, you find the joint line, place a dot on the joint line and measure 2 inches up from there, and then you measure 2 inches up from there, and then 2 inches and 2 inches, so it's 2, 4, 6, 8, 10. I'm gonna take this is all measured in inches, I'm gonna line up the 0 with the dot. He has a circumference of 15 inches. And I will do the same thing once more. And he has a circumference of 17, 19, 20, and then the last measurement is about 22 and a half. That's it.